So good morning, good afternoon, everyone, wherever you're calling in from. I appreciate you being online with us today. We've got a sold out webinar today hosted by Prevention Plus Wellness, LLC, located here in sunny St. Augustine, Florida. Yesterday was cold, it was rainy, and today's a beautiful day as I look out my window, and I hope it's nice where you guys are calling in from and that it's warming up. Spring is on its way, and so hang in there, everyone. I hope you're well and COVID free. And, extraordinary times we're going through. I understand that there's lots of challenges and chaos going on. And so I'm even more appreciative of all that you do for kids, for young adults, for families in your communities, wherever you're calling in from. So today's topic, as you can see, by the way, I'm Dr. Chudley Wirch. I'm the developer of our programs here, CEO and founder at Prevention Plus Wellness. Today's topic is screening and brief intervention for youth substance use prevention and wellness. So all Prevention Plus Wellness programs are screening and brief intervention. So I'm going to give you a broader view of the whole field and the evidence, and to talk about a lot of things associated with screening and brief interventions, which are some of the most highly regarded in terms of efficacious strategies for influencing health behaviors, including prevention as well as intervention and treatment. So these are today's objectives. I am recording this session, so I will be sending everybody who's registered today a link to the recording. I'll send you a PDF of all the slides. And I will be sending everyone a certificate. If you're listening in, you can have a certificate and put your name on it for 1 hour CEU. Okay. If you need anything else from me, just let me know. You could always reach us through our website, preventionpluswellness.com, or you can email me directly at info at preventionpluswellness.com. All right, so there's the 4 objectives. We're going to be together identifying various screening and brief intervention. That's SBI, screening brief intervention practice models. Screening and brief intervention has been identified by a number of national and international agencies as evidence-based practice. Evidence-based practice at this level, think about that, and then evidence-based, individual evidence-based programs are below that. So practice is a little higher level of evidence-based, which means research supported. Number 2, we're going to explore evidence-based systematic reviews and peer-reviewed research supporting SBI for preventing youth substance use and even promoting their healthy habits. Thirdly, we're going to examine screening and brief interventions that are found in evidence-based registries, one registry in particular, Blueprints for Healthy Youth Development. And lastly, we're going to be discussing as we go along the implications of this content for you, youth services provider, whether you're substance use prevention specialists, health professionals, coaches, fitness specialists, regardless of what your particular profession or background is, including parents. So this is good content, I think, for everyone who works with and interacts with young people, from children on all the way up through young adults. So let's take a look at screening and brief intervention practice models, first of all, because screening and brief intervention means a lot of things to different individuals. There's no one particular definition, agreed upon definition. So here's one that actually came from SAMHSA. That's the Substance Abuse Mental Health Services Administration. You could read it there. Screening brief intervention is a public health approach. So the idea is to get the message out to as many individuals as possible, and the message being this practice, being this strategy, being evidence-based. So it's an evidence-based practice, public health approach designed to motivate individuals. So it's a motivational intervention. Education is a part of that, but the real key is to motivate youth or young adults, or adults for that matter, to engage or to avoid certain behaviors, avoid risk behaviors, engage in protective wellness behaviors. So motivate individuals at risk for substance use disorders and related health problems to change their behaviors by helping them understand how their substance use puts them at risk and to reduce or give up their substance use. So that was the original definition. Again, still today, the focus is a screening brief intervention is largely focused on substance use. Intervention, primarily, more recently prevention, and then certainly with our work and others, promoting other healthy behaviors as well. Now, there's a number of models for SBI, screening brief interventions. You can see 7 of them there listed. These are very common terms or models. So let me just go down through them. One is brief intervention, BI. That's the broadest term. Anything that's brief, and there's no agreed upon definition, by the way, of brief. So it could be 1 session, it could be 6 sessions. Typically, it's I think 4 or less sessions. So it's really not a very clear definition. And a brief intervention could be anything. It could be an individual, group, policy, just about anything. So brief intervention is the more generic term. Number 2, screening and brief intervention. We'll use that quite a bit today. That indicates a certain kind of a brief intervention that uses screening first. Thirdly, SBIRT, which is screening and brief intervention and referral to treatment. We'll talk a little bit more about that, obviously. Motivational interviewing is a counseling strategy, an open-ended counseling strategy. That's one model. Single session intervention, SSI, is a term used particularly in the mental health area. PPW is prevention plus wellness. That's our spin on an adaptation of screening and brief interventions. You'll learn more about that. And lastly is FRAMES, which is actually a framework for creating brief interventions. So FRAMES stands for, as you can see there under item number 7, feedback, responsibility, advice, menu of options, empathy, and self-efficacy. And FRAMES is a typical, sort of highlights the typical components of most screening and brief interventions, whether they be screening and brief intervention or SBIRT or even motivational interviewing, single session interventions, PPW. FRAMES is a very common tool to create these screening brief interventions. So those are some of the different models or terms or even definitions of screening and brief intervention. These are some of the agencies that have identified SBI as evidence-based practice. You've got SAMHSA has identified and in fact created their own screening and brief intervention called SBIRT, which I talked about earlier. That's screening and brief intervention and referral to treatment. CDC, Centers for Disease Control, has alcohol screening and brief interventions. World Health Organization has identified screening brief interventions for substance use problems as evidence-based practice. The National Institute on Alcohol Abuse and Alcoholism has a focus on alcohol screening and brief interventions for youth. And the American Academy of Pediatrics has identified substance use screening brief intervention for youth. So lots of agencies, these are just some of them that have identified screening and brief intervention or some version of that, for example, SBIRT, as an evidence-based practice. Okay, as we go along, a lot of content here. You have questions, type it into your chat space or Q&A, and I'll address it as at the end of today's session. So let's take a look at just two very quick, two reviews of research in this area of screening and brief intervention. So this is an older review, but it was such a massive review by Baber and colleagues back in 2008. They reviewed at that point research examining a screening, brief intervention, referral to treatment over the past 25 years. And what they found is during the 1980s, they found over 100 clinical trials that tested the efficacy and cost effectiveness of SBIRT for alcohol use. In the 90s, These reviewers, these researchers found that there are multiple trials of Espert on other substances beyond alcohol, including illicit drugs, tobacco, prescription drugs, for example. They concluded that Espert yields short-term improvements in individuals' health, and they said that this data is irrefutable. And number 5, that long-term effects are likely and have been demonstrated in simulation studies, but long-term studies need to be done. Okay, lots of good support for screening and brief interventions, particularly for alcohol use, but even more recently for other substances. Then there was a more recent review in 2019. This assessed the effectiveness of screening and brief interventions to reduce hazardous or harmful alcohol consumption. And this was in a particular setting, either in general practice or emergency care setting. So this is primary care. So, and much of the research is, I should say, focused on clinical settings. And by that, I mean, again, medical settings like primary care, emergency settings, etc. So this was a meta-analysis, included 34 studies and provided moderate quality evidence that brief interventions can reduce alcohol consumption compared to control groups. Brief interventions can reduce harmful and hazardous alcohol consumption in men and women. And the study concluded that short advice-based interventions may be effective as extended counseling-based interventions for patients with harmful alcohol use. So again, this was a review of a number of studies, in this case 34, which showed evidence of screening and brief interventions in clinical settings, at least, as being effective for alcohol use in particular they looked at. Now let's take a look at some research, a little bit broader research supporting screening and brief interventions, but then also a little bit more narrow, because we're going to look at just youth being, primary adolescents and young adults. So let's take a look at the support, research support, and again, try to find as many reviews as possible. I like the reviews of research because they synthesize more than one study. So we really want to look at as broadly as possible. So here is a review on alcohol brief interventions for adolescents and young adults. This was published in, as you can see there, Journal of Substance Abuse Treatment 2015. I thought this was very good because the focus again on adolescents and young adults found that brief alcohol interventions yield beneficial effects. Those effects lasted for up to a year. And as an aside, the researchers found that goal setting was associated with larger effects. Keep that in mind. Goal setting seems to be an effective strategy in these brief interventions. And the effects of these these brief interventions, these alcohol interventions, consisted across diverse settings, formats, and populations. So that was a review, effectiveness, alcohol, brief interventions for youth and adolescents and young adults. This review was of substance misuse in adolescence. The focus was on a review of research on Espert, screening, brief intervention, referral to treatment. And 2011, the American Academy of Pediatrics released a policy statement recommending the wide use of Espert among adolescents by pediatricians, and that pediatricians should screen adolescents for substance use and for every well exam, as well as acute visits when possible. So that's the recommendation. Espert's an effective method, according to this review, to address adolescent substance use. So this review, linked to the American Academy of Pediatrics, recommends and found screening and brief interventions effective for adolescents for substance use. Here's a meta-analysis, a statistical analysis or review of brief interventions for substance use in adolescents. It synthesized the evidence regarding the effects of brief behavioral interventions for adolescents ages 12 to 20. with problematic substance use. And in this case, the authors found motivational interviewing, this counseling strategy, open-ended strategy for motivating young people in this case, found that motivational interviewing reduced heavy alcohol use days, and substance use related problems among adolescents. Did not have that kind of impact, however, on cannabis use days. So effective, again, brief interventions, this case motivational interviewing for adolescents and alcohol use. I said before, when we sort of opened up today's session, that the SSI, single session interventions, is a term used particularly in the mental health area. So this is a review of single session interventions for youth mental health. And these authors said that SSIs may offer a promising path toward improving accessibility, cost effectiveness, and completion rates of youth and mental health services. And their review found that SSIs are structured programs that intentionally involve only one visit or encounter in a clinic or provider or program, and they may serve as a standalone or adjunct clinical service. So you can see the flexibility and the breadth of these brief interventions. And these researchers concluded in their review that a growing body of evidence supports the capacity of single session interventions to reduce and prevent youth psychopathology of multiple types. So not just substance use, but again, brief interventions being utilized to also prevent and reduce mental health issues among young people. This intervention, this review examined brief interventions for cannabis use among emerging adults, in other words, young adults. So eligible brief interventions were operationalized as 1 to 2 sessions. So there's the definition that they used, focused exclusively on cannabis use. And the age ranges of participants were ages 15 to 30 years old. Most interventions were motivational, single session, delivered in person. Existing brief interventions show benefits for symptoms of cannabis use disorder, as well as abstinence. And so these authors concluded in their review of research that brief interventions show promise for other outcomes, even beyond just cannabis use disorders and abstinence. So here's some effectiveness shown for cannabis use brief interventions among young adults. There's quite a bit of research in the area of taking brief interventions, and other than presenting them live in person, computerizing them. And so here's a review done in 2017 of computerized brief interventions for young people, and the interventions significantly reduce alcohol consumption in the short term, no long-term, as compared to no intervention. The effect sizes were small, and there was no significant effect long-term. So this review found these computerized brief interventions had a positive effect short-term, but not necessarily a long-term. A few studies on cannabis did not show significant effects on cannabis consumption, so they're concluding under number 4, computerized brief interventions seem to reduce risky alcohol use among young people, no effects on cannabis consumption. And this, again, was limited to computerized or online virtual versions, if you will, of brief interventions. By the way, as you can see, all these slides have a link on the bottom of them. So when I send you this PDF of the slides, you'll be able to, if you wish, go and read more about these individual studies. Here is a, let's see, is this a review? Yeah, another review of interventions for substance use disorders in adolescents. This was a very broad review, included interventions in general. But what we did is I picked out from this the focus, which had quite a bit of a focus on brief interventions. So this was, for example, this reviewed behavioral interventions, pharmacological, combined interventions for adolescents ages 12 to 20 with problematic substance use or substance use disorder. And part of this review showed that motivational interviewing reduced heavy alcohol use, of which there was low scientific evidence, alcohol use days, which there was moderate scientific evidence, and reduced substance use related problems, of which there were low scientific evidence, but does not reduce cannabis use. So again, motivational interviewing found to reduce heavy alcohol use days, and substance use related problems, but not necessarily cannabis use. And also the studies in the college settings supported the use of brief interventions for students with any use, heavy use, or problematic use. So a little bit stronger evidence for the young adults in the college setting, but nonetheless some support again in this review for motivational interviewing. This was one of the more interesting studies because I think it's relevant to a lot of us who are, a lot of you who are on online right now, because I think many of the people that view our webinars are not necessarily clinicians. We do have a lot of counselors, but we also have a lot of prevention and health providers that are not in clinical settings. And that's what this study was about. It was about looking at universal school-based SBIRT, screening, brief intervention, referral to treatment for prevention. And so this was not a review, this was a single study. The aim was to look at SBIRT as a model for high schools and non-clinics. You know, some schools, particular high schools, have school-based clinics. This was, I think, one of the, if not the first study of looking at a screening and brief intervention in schools not in clinics. So a relatively large population, or sample size, I should say, over 2,500. The results showed that screening, brief intervention, referral to treatment has potential to delay substance use among current abstainers. In other words, this is one of the first studies to show that brief interventions could actually prevent substance use. Up until now, most of the research we're looking at really focuses on heavy users, current users, binge drinking, problematic substance using disorders. And so this really shows the potential from the prevention, universal prevention perspective. So these authors concluded that screening SBIRTs are feasible as a universal method in high school settings, even those without school clinics. In other words, they just presented this, I believe, in 10 high schools in classes. Brief motivation interventions for alcohol and cannabis use among adolescents. This is one of the more recent studies. This is a single study now, and I thought it was interesting because, again, the focus was on alcohol and cannabis. What this study looked at was, excuse me, a randomized controlled study in 4 primary care clinics, PC clinics. And they used a 15-minute brief motivational interviewing where they addressed alcohol and marijuana use, and consequences can't get much briefer than 15 minutes. The sample was 294 youth, and this brief motivational intervention was found to reduce negative consequences from alcohol and marijuana use a year later after that 15-minute intervention. And the researchers concluded that the findings emphasize that adolescents can benefit from primary care interventions that briefly and effectively address both alcohol and marijuana use. So here's, while there seems to be some question about the efficacy of brief interventions for marijuana use, this showed that they can be effective. So there's a bunch of studies there that looked at screening and brief interventions of different formats, whether there be brief interventions, SSIs, SBIRT, motivational interviewing to be effective among young people, adolescents, or young adults for alcohol, other substances. So now let's take a look at the evidence, I should say evidence-based screening and brief interventions for youth and young adults, actual interventions listed in an evidence-based registry. So what we're looking at here is we took the registry of Blueprints for Healthy Youth Development, which really has very high standards for listing evidence-based programs. And so we did just yesterday. And what we did was we went to their to the Blueprints for Healthy Youth Development registry website. We typed in the search term screening and brief. We came up with 26 programs. We reviewed them for those programs that were truly screening and brief interventions. And we came up with 4 programs. And so 4 programs were identified as screening and brief interventions that were listed as evidence-based programs on the Blueprints for Healthy Youth Development registry. And here they are right now. One is the BASICS program. BASICS stands for Brief Alcohol Screening and Interventions for College Students. And you could read the description of the BASICS program right there. Brief motivational intervention, I should say, for high-risk college students that uses alcohol screening and feedback to reduce problem or excessive or binge drinking. And that's among college students. And the focus is on motivating them to change, to promote healthier choices, to review myths and facts about alcohol, and to teach coping skills regarding moderate drinking. I believe this program had 2 sessions to it, if I recall. The outcomes are alcohol. The program type is cognitive behavioral and school individual, and it's implemented in school settings. Again, this is a college setting, and that's BASICS, the BASICS program. A second evidence-based program that we found that uses screening and brief intervention and listed on in the Blueprints for Healthy Youth Development is Cannabis E-Checkup To Go. And as you can see the description, it's a brief web-based. As I said before, there's quite a bit of research creating online versions of these brief interventions. Here's one here listed as an evidence-based program. And it's a web-based personalized feedback program. It aims to reduce harms associated with cannabis use. Again, the focus is in college students by increasing protective behavioral strategies, correcting misperceptions, misperceived norms for cannabis use. Perceived norm could be that, for example, assuming or thinking that most of my friends are smoking cannabis or using cannabis. So this had outcomes on marijuana or cannabis. It's a drug prevention / treatment, school setting, online. So there's 2. Now there's 2 more that were identified as evidence-based programs. These 2 are actually developed by us. The InShape Prevention Plus Wellness Program is the first. Brief prevention intervention to improve physical, mental, and spiritual well-being of college students. Again, this is the 3rd college students, although I will tell you that the InShape program is also used in non-college settings and community settings. Even the US military is using the InShape PPW program. So the InShape program focuses on connecting positive health habits and images with the avoidance of alcohol, risky tobacco, and other substance use. The program outcomes for InShape for alcohol and illicit drugs and other measures. It's cognitive behavioral, drug prevention, school individual strategy, and implemented in schools and, as I said, other settings. That's the InShape Prevention Plus Wellness Program. The other program listed on Blueprints, which is also developed by us at Prevention Plus Wellness, is the I see a little typo there, is the Sport Prevention Plus Wellness Program. Sports program that highlights the positive image benefits of an active lifestyle to reduce alcohol, tobacco, drug use, high school students, although we have a middle school and elementary school version too, to improve their overall physical health. It's a screening and brief intervention. Outcomes on alcohol, marijuana, tobacco, physical activity. And it's in school settings, although I will tell you that sport program is used in all 50 states and implemented in just about any setting where youth are found: boys and girls clubs, sports, after school, during school, juvenile justice, just about clinical settings, etc. That's the sport program. So 4 evidence-based screening and brief intervention programs that we found, and there I'm sure are others if you look at other evidence-based registries. Now let's take a look at research which supports screening and brief intervention for youth, which addresses multiple risk behavior prevention. So more than, let's say, just alcohol, okay? And so this was a review published 2018, which looked at physical activity interventions for adolescents. And they found that, that physical activity interventions decrease substance use in teens. Most studies use group sessions, but some decrease substance use also with just a single one-time multi-health consultation, which is a screening and brief intervention. So these researchers concluded that school-based interventions targeting multiple health behaviors like physical activity and substance use can be effective and efficient way to decrease substance use among adolescents. And that was a review of interventions. And then there's our own research of our own programs. So here's some research of studies that were published in these 4 scientific journals, peer-reviewed publications of the efficacy of the sport single session prevention plus wellness program, screening and brief intervention. And this is just a synopsis of the findings across those studies in those 4 publications. The single session sport program significantly decreased the number of measures of alcohol use and problems, increased physical activity, reduced cigarette smoking with some effects a year later. For those using substances, those kids using substances, reduced binge drinking, smoking, marijuana, increased physical activity. For even a year later, increased parent-youth communication. We had one study of the flyer of 3 flyers, parent flyers, using the sport format, and those were also effective in preventing alcohol, marijuana use. And we had one translation of the sport PPW program in Turkish and Turkish language, and conducted a controlled study in Istanbul, which found it, even with that much different culture, different from the United States culture, found that sport was effective in improving a number of indices of health: physical, mental, nutrition, sleep, etc. There's been a few studies conducted of the evidence-based InShape prevention plus wellness program for young adults. These are the publications that had these peer-reviewed articles. And here's a summary of the outcomes from these programs. InShape reduces frequency and heavy use of alcohol. I think that's really important because heavy use is where the problems arise. Significant reductions in drinking and driving even a year later, reductions in marijuana use, including heavy use, increased sleep, exercise, healthy eating, improved social and spiritual health-related quality of life, and improved body image satisfaction. So what can we conclude from some of this that we already talked about? Quite a bit of research. I would say this: number 1, screening and brief interventions are evidence-based practice. We already showed you that from a number of agencies like SAMHSA, World Health Organization, and so on. So evidence-based practice, screening, brief interventions, found to prevent and reduce alcohol use, other substance use, and associated with improvements in mental and physical health. Youth services providers, I'm on number 2 now, can use screening and brief interventions as a standalone or an adjunct program to their other prevention, intervention, treatment programs. not just in clinical settings, primary care, for example, very good, but also school settings, after school settings, community settings, et cetera, so that you can have a full public health reach. That's what these brief interventions are about, reaching everybody in your population. And lastly, multiple risk behavior screening and brief interventions for youth and young adults may be the most cost-effective and time-saving approach to use as compared to single-session interventions. Think about it. You have a program designed, intervention to prevent alcohol, and then one for e-cigarettes, and then one for marijuana, and then one to improve physical activity. But if you address all of these things in one setting, in one intervention, that could be very, very cost-effective and may even increase the breadth of your program outcomes. Now we're going to be a little bit more focused. Some of this material you may have heard of before if you've listened to some of our presentations, because we're going to talk a little bit about the multiple risk behavior screening and brief interventions at Prevention Plus Wellness. Here's the evidence-based practices screening and brief intervention model. It's a three-step model. Step one, you screen youth for their current health habits, substance use, but whether that be alcohol or e-cigarettes or marijuana or opioids, but also protective wellness behaviors, physical activity, breakfast, nutrition, sleep, stress control. Secondly, you provide positive image feedback found to be effective, designed to elicit or cue unconscious images of young people in the future being more fit, active, healthy, successful. This is designed to increase motivation for change. And then your communication, your feedback also talks about how cannabis or alcohol or opioids harms the achievement of those positive wellness behaviors, benefits, and images. And then youth are motivated for change. And then that's step three, you take advantage of that or capitalize on that by helping youth initiate behavior change, not just to avoid substance use, but to improve protective wellness behaviors, particularly physical activity, breakfast and nutrition, sleep, and stress control, but even other areas. So that's the three-step screening and brief intervention model used at Prevention Plus Wellness. Now, this is really important, I think, because what I'm going to show you here is compare and contrast screening and brief intervention experts on the left with PPW screening and brief interventions on the right. So you get a better feel for, what are the similarities, what are the differences. So start on the left. Number one, typical screening and brief interventions, including expert, assumes individual ambivalence. In other words, if we're working with young people, we assume young people don't have any thought about and really don't care about making any changes in their behaviors. And so that's what's the focus of the screening and brief intervention. If you look at number one on the right, PPW screening and brief interventions is based on the behavior image model. So there's actually a conceptual model for PPW screening and brief interventions, of which I'll share a little bit more information about. Go back to number two, typical screening and brief interventions screen to identify risky behaviors, shift over to PPW programs. Screening is done to increase awareness of substance use and healthy behavior. So there's a large departure there. Typical screening and brief interventions, you screen to identify those at high risk. Number three, those that are identified at high risk, you provide feedback and advice on substance use and individuals. So you're really focusing on the screening to screen out high risk. Whereas in the right-hand side, the PPW model, you screen to increase awareness. And then number three, you provide feedback to everybody and advice to everybody on substance use avoidance and healthy behavior promotion, and how these behaviors, healthy behaviors and substance use behaviors, interact with each other. So a much more inclusive intervention, PPW. Back to number four with regular PPW. Back to number four with regular screening brief intervention. You refer high-risk individuals to treatment if it looks like they need it. Shift over to number 4 to the right-hand column, PPW, you conduct multi-health behavior goal setting and contracting for participants. Remember back in that review of research I showed you that brief interventions that use goal setting had larger effect sizes. And so this is very important, I think, in PPW screening and brief interventions, that number 4, that they include goal setting. Shift over to number 5, the left-hand column, typical screening and brief interventions, usually clinical settings, primary care, emergency settings. And number 6, they're indicated prevention, they're interventions, they're for the highest problematic use, heavy use, binge drinking, substance use disorders. If you shift over to the right, PPW programs, number 5, can be done and are usually done in school or community settings, and they can be implemented as universal or selective or even indicated intervention. So you've got much more flexibility, I think, with the PPW screening and brief intervention. So there's a comparison and contrast. Again, any questions? Does this make sense to you? If not, shoot me an email, post it on the chat or question and answer. Prevention plus wellness screening and brief interventions has used the FRAMES model to ensure that what they address is screening and brief intervention. So, for example, the first part of FRAMES, F, feedback. A PPW provides feedback on personal risk, substance use harms wellness behaviors, and feedback on positive identity. And that's the second step of PPW screening and brief interventions, feedback. That's the F in FRAMES. The R in FRAMES, responsibility for individuals. And PPW screening and brief interventions tells young people in the scripted programs that it's your choice to change. It's up to you to decide whether you set goals, for example. The A in FRAMES is advice to change, and PPW screening and brief interventions provides advice regarding healthy behaviors, wellness behaviors, and avoidance, and in fact, make recommendations to engage in all the wellness behaviors, physical activity, regular physical activity, plenty of sleep, eating breakfast, eating plenty of fruits and vegetables, practicing stress control. All of that is advice. The M in FRAMES is menu, that's the blue bar to the right, a menu of goals and strategies. And PPW programs do allow participating adolescents or young adults to set and monitor the goals that they want to. And they could choose from, again, goals related to physical activity, goals related to breakfast, nutrition, goals related to sleep, goals related to stress control, all of those wellness behaviors that to a certain extent protect against substance use and also promote greater mental and physical well-being. The E in FRAMES is empathetic, and PPW programs does present positive and supportive communication and images to young people. S stands for self-efficacy, and communicating optimism and positive change is possible, and practicing of goal setting is in the instructions of the goal setting for those adolescents or young adults provided with a PPW program. And so FRAMES is integrated and addressed in PPW screening and brief interventions. The difference between PPW screening and brief interventions and other typical screening and brief interventions, or SBIR, is the fact that PPW programs use the behavior image model. It's a wellness-based theoretical construct or framework or roadmap, if you will, for creating brief interventions that integrate the prevention and avoidance of substance use with the promotion of protective wellness behaviors. So, for example, promoting physical activity while preventing alcohol, promoting healthy nutrition while preventing vaping e-cigarettes are examples of the application of the behavior image model. The behavior image model has 3 components. Number 1, communicating positive, aspirational, peer and social future images as values, and then connecting and increasing motivation for change, connecting substance use with protective wellness behaviors, and that communication of positive images increases motivation for change. The second component to the behavior image model is the multiple behavior goal setting that initiates behavior change, and over time, youth develop self-control or self-regulation skills, self-efficacy, and self-confidence as well. And the third piece is really providing parent materials or getting parents involved to support their youth or their young adults in positive behavior choices, communicating with the parents about health issues, and helping youth monitor and continue to set goals over time. Here's the simplified behavior image logic model. You can see this on our website. I'm just going to skip past that because I think I've shared this enough with other people. Here are the prevention plus wellness screening and brief interventions that we offer. Of course, sport for youth, sport PPW for youth, in shape PPW for young adults. We also have adaptations of those two programs in the form of a marijuana PPW program, a vaping, which is our e-cigarette PPW, opioid PPW. We have a Sport 2 Prevention Plus Wellness program, which is our only multi-session program. All the other programs are one session. Sport 2 is 6 lessons. An In God's Image program, which is a free spiritual program, racial justice PPW. And because parents are so important, we do have parent programs as well, single session programs where you, as a provider, can train parents to have parents provide the same positive image communications and goal setting with their youth at home. So let's have a final conclusion, if you will, and implications. Number one, PPW screening and brief interventions are similar to other screening and brief interventions, but as you've seen, and in particular, they're similar because they address the FRAMES model, elements, FRAMES, but they're also different, obviously, different in a number of ways. They can and are being used for universal selective and prevention intervention. They don't screen to eliminate anybody or to focus just on high risk, but instead present essential motivational intervention for all youth, and addresses not just substance use, but these protective wellness behaviors in a integrated multi-risk behavior approach. Number two, PPW screening and brief interventions are based on the behavior image model. They can be used by just about any youth services providers, teachers, coaches, parents, in any setting, high-risk kids, universal, all youth, in sports, out of sports, in any setting imaginable, to create, to integrate and address multiple health risk behaviors essential to the mental and physical well-being of young people. That's PPW screening and brief interventions. And over time, we've continued to increase the number and variation of PPW screening and brief interventions. Sport addresses largely alcohol, in shape largely alcohol, even though the outcomes were also shown in other substances like marijuana and tobacco. But we then created programs based on feedback from providers like yourselves, professionals like yourselves, to create programs that address marijuana, vaping, opioids, racial discrimination, et cetera. And that's what we've done for you. So we've expanded from high school to young adults, to young adolescents, to children, and including parents. So really, we've expanded our reach and our breadth with our unique screening and brief intervention. Remember, screening, brief intervention, evidence-based practice. Here are some additional resources for you. I'll send you these slides so you can click on these links if you're interested in SPURT for school social workers, for youth, for SPURT, for primary care, et cetera. Some good extra resources for you. You can learn more about what we offer in terms of screening and brief interventions on our website, preventionpluswellness.com. There's a link to our catalog of our programs, and you could sign up to receive a sample of any of our programs. Preventionpluswellness.com is our website. Info@preventionpluswellness.com is where you can email us. And our phone number here in St. Augustine, Florida is 904-472-5022. And thank you all. I'm going to pause at this point. Once again, God bless you for all you do for youth and young adults in your area. Let me see if anyone has any questions or comments about this content. Screening and brief interventions in general for youth, addressing substance use, addressing multiple risk behaviors, addressing healthy habits. Let's see if anybody has any comments or questions. I'm going to go to the questions right now. I don't see anything. People are just saying good morning, hello, good afternoon, that you can hear me. That's good news. So thank you all for joining. Last chance. Anybody have any questions, any comments? Here's a Q&A comment. Let me just check that. Can we get a copy of the PowerPoint today? Yes, you can, Tara. Don't need to email me separately. I will send everybody who's registered, Tara, a copy of the slides, a link to this recorded webinar, and a certificate for 1 hour CEU for listening in. So Tara, no worries, no problems. If you don't get it, check your spam folder. You're welcome, Tara. Check your spam folder, because chances are, because of the attachments, it could be sent to your spam folder. So keep an eye on that, okay? And that was from Tara. That was a good question. Let me see if anybody else had any questions, comments. Some thank yous from some good people, and I thank you for listening in. I thank you for what you do for young people and families in your area. If there's anything we could do, if there's anything you need from us, you want us to create something new, you need some resources, whatever you need, email us at info@preventionpluswellness.com and let us know. You know what we're all about now? We're all about brief, cost-effective interventions. We're about integrating the prevention of substance use risk with the promotion of protective wellness behaviors. In other words, we want to address the fact that most young people don't get enough physical activity, don't eat breakfast, don't eat fruits and vegetables, aren't getting adequate sleep, aren't controlling their stress. We want to address all of those risk factors plus substance use risk in very cost-effective interventions. Most of our programs are single session, and you could do that because there's screening and brief intervention, which is evidence-based practice. Okay, thank you so much. Thank you for your kind comments. Everyone, have an awesome afternoon. Take care of yourselves, your families, stay healthy. And I do hope you'll join us for future webinars, and check out our website, preventionpluswellness.com. Thanks, everyone. Bye-bye.